Mike.
Hi.
Hi, my name's Nicole Reifert. I'm a CSU and BPA student. I'll be conducting your exam today. Is that okay?
Yeah, that's fine.
Wonderful. I'll be working with PA Mike Jorgensen, and we'll be in collaboration and talking about your care today.
Okay. What's a PA?
That's a fantastic question. So a PA is a highly trained medical professional who works in collaboration with other medical providers, such as a physician or another PA. We're able to do complete medical care from, say, annual exams to really specialty care and surgery. So we have a really big scope of practice.
Great.
Wonderful. So what we're going to be doing today is I'm going to be obtaining your vital signs. And I want to be kind of talking throughout this exam to the proctor in the room, so you might hear some medical terms that you might not be familiar with, but then we can talk about the results.
Okay.
Okay? So make sure we're washing our hands. I'm observing my patient's general appearance and status. I notice that he is alert, awake, and responsive. He's in no apparent distress. If he was, I would document. I would notice any kind of, if he was tripoding or having difficulty breathing, or any kind of diaphoresis or sweating. I also notice that he's well developed and well nourished. So he has a good nutritional status. And if I did notice any of the pertinent positives, such as dress, odors, facial expression, posture, or any kind of speech when we were discussing and having that conversation, I would also note that as well. So I'm going to be doing your vital signs. So first I'm going to be placing this pulse oximeter, which tests the amount of oxygen in your blood. So press the power button, and this is just going to go right on your finger, and you're going to relax your hand right here. And that's just going to give us a number out of 100 and see what your level of oxygen is. So right now it's reading about 96, but we're going to leave it on there for a little bit. I'm going to be putting my fingers on your radial pulse, which is right underneath your thumb here on your wrist. So you might feel some pressure. And I'm going to be testing this for 30 seconds and then multiplying this number by 2. And it's already up to 97. Look at that. So it's around 30 after 30 seconds. Multiply that by 2, it's around 60 beats per minute. I'm also going to put your hand, if you don't mind, across your chest, and I'm actually going to feel for your respiration, so how your chest rises and falls, and we're going to measure that for your respiratory rate. And we're going to do that for about 30 seconds as well. So it's around 7 breaths over that 30 seconds. So we multiply that by 2, it's about 14 breaths per minute. And for your pulse, just bring your hand down here. I'm going to touch on both your pulses, distally, sort of pressing both the radial arteries and measuring the rate, making sure it's symmetric, and the rhythm, making sure that it's regular or irregular, and it's nice and regular. Perfect. I'm going to be getting a palpable systolic blood pressure. So I'm going to be putting the blood pressure cuff in your upper arm here, okay? Yeah. It has an artery index marker. I'm going to roll up your sleeve to expose your upper arm. We're going to light up the artery index marker right where the brachial artery is. You can palpate it so you know exactly where you're going. About 2 to 3 centimeters above the cubital fossa, and making sure your cuff size is appropriate. So at least 40% of the upper extremity is covered, and it wraps around circumferentially easily. Rest your hand here. I'm going to be palpating the radial artery on the side that we have the cuff on, and I'm going to pump up the cuff so you're going to feel a squeeze. And when I don't feel the pulse anymore, that's going to be my palpable systolic blood pressure, and I'm going to add 30 millimeters of mercury to it. So at 110, I felt the pulse come back after slightly deflating, so we're going to add 30, that's 140 millimeters of mercury. I'm going to let this hang on your arm for a second, let your arm relax, And we're gonna get your temperature, and then we'll listen for your blood pressure. So put the probe on, make sure it's blue. Little guy says it's ready. This is gonna go underneath your tongue, you're gonna close your mouth around it. Perfect. 98.5, perfect, thank you. Make sure we dispose of it in the garbage. And put it back. So it's been about, say about a minute or two, so now we're gonna check for the auscultative blood pressure, okay? So using the bell of my stethoscope, I'm gonna hold your arm about heart level. I'm just gonna relax it in my hand. I'm gonna place it over the brachial artery using my thumb. And you're gonna feel that squeeze again. So I'm gonna pump it up to 140, which is that palpable systolic blood pressure. And I'm gonna deflate it about 2 to 3 millimeters of mercury a second. So it's about 108/68. That is an excellent blood pressure. Okay. Are you in any pain today, Mr. Lane?
Nope.
No? Okay. Well, that concludes the vital signs, and I will go discuss with my supervising PA, Mike Jorgensen.
Okay.
And cut.